Welcome to Insider Medicine In Depth. I'm Dr. Susan Sharma. Taking lenalidomide, a medication popularly known as Revlimid, can help stave off the progression of multiple myeloma following a stem cell transplantation, according to research published in the New England Journal of Medicine. Here is some information on multiple myeloma. It is a cancer of the plasma cells located in the bone marrow. Tumors form within solid bone, and the body has difficulty making healthy blood cells and platelets. It mainly affects older adults. Researchers from the Roswell Park Cancer Institute recruited 460 individuals who underwent a stem cell transplantation for the treatment of multiple myeloma. 100 days after this treatment, the participants were randomly assigned to receive lenalidomide or a placebo. They continued this treatment until their disease started to progress. The response to lenalidomide was so positive that the trial was actually stopped early, and some of those who were in the placebo group started taking the active drug. While the study was first halted, 20% of the participants taking lenalidomide had experienced a progression of their disease or died, compared with 44% of those taking placebo. After an average follow-up period of nearly 3 years, 37% of those taking lenalidomide experienced a progression of their disease or died, compared with 58% of those taking placebo. It took an average of nearly 4 years for the participants taking lenalidomide to experience a progression of their disease, compared with over 2 years for those on placebo. Death rates were 15% with lenalidomide and 23% with placebo. New cancers occurred among 8% of those on lenalidomide, compared with 3% of those on placebo. We had a chance to speak with Dr. Philip McCarthy, principal investigator of the study, who offered some further insight.
Low-dose lenalidomide given in a maintenance treatment setting can prevent the multiple myeloma from coming back or progressing. This is after the patient has received some form of upfront therapy. In 2 of the studies, it was after induction therapy and then transplant, and in the other study, it's after lower dose therapy. Our study and the one from Italy looked at prolonged therapy. The one from France was planned to look at prolonged therapy, but stopped the lenalidomide early because there was concern about second cancers. What we did see is that there was an increased incidence of second primary cancers or second primary malignancies in the patients receiving lenalidomide maintenance. This is sort of a hard thing to sort out because it wasn't a big signal. It's about a 2- to 3-fold increase in both solid tumors and hematologic disorders. So what this means is that patients need to be monitored very carefully if they elect to go on maintenance therapy, after discussion with their physician. And we're just going to have to see over time. We do know that when we looked at the risk of a second cancer, was higher in the lenalidomide group, but the risk of progression or the risk of dying of the myeloma was higher in the placebo group.
Today's research demonstrates that lenalidomide shows promise for helping to slow the progression of multiple myeloma. For Insider Medicine In Depth, I'm Dr. Susan Sharma.